Merci tout le monde d'être présent aujourd'hui. Donc aujourd'hui, on a
Thank you everyone for being here. We have Minister Rodriguez and Minister Sajan to give an update on the deployment of the Canadian Armed Forces in the long-term care homes and on the helicopter that crashed. So please feel free to ask questions on those two subjects.
Mr. Sajan for an update on the deployment of CAF members in our senior centers and on the helicopter crash. So I'd ask you to keep your questions on that topic. There will be a noon presser for other topics. Ministers?
Good morning, everyone. First, I would like to provide an update regarding the tragic loss of 6 members of the Canadian Armed Forces in the Ionian Sea. Yesterday, the Prime Minister, the Governor General, the Chief of Defence Staff, the Deputy Minister, and I joined the loved ones of these fallen comrades at CFB Trenton for the repatriation ceremony to honor this heartbreaking loss to our nation. I want to again express my deepest condolences to the families and loved ones affected by this. I've seen firsthand the incredible work that our women and men of the Canadian Armed Forces do every day to help and protect Canadians at their most vulnerable moments. Since I've been Canada's Minister of National Defence, I had the privilege to meet some of these members while they served. I will hold these memories close to me, such as the honor I had to present Abigail with her degree at our graduation at the Royal Military College, or the privilege of meeting Matthew Cousins in 2016 while he served in HMCS Charlottetown. The loss of these brave women and men is not just a loss for the Canadian Armed Forces, but for all Canadians. We continue the search for the remaining 5 fallen heroes. In addition to the ongoing flight safety investigation, we are actively working on options to recover the remaining fuselage, which will assist with the investigation. And last Friday, a flight safety investigation team comprised of 7 personnel arrived in Italy to investigate the circumstances of the accident. Now, this team includes investigators, a medical advisor, a technical engineer advisor, and a representative from Sikorsky. The flight data and voice recorders have been recovered and are currently back here in Canada with the National Research Council to be analyzed. Concurrently, separate military investigations will be conducted to help determine the potential causes of the incidents and to facilitate administrative support to family members. These thorough and professional investigations will help find the answers that the families deserve. We will provide all needed support to the families during this difficult time, and we continue to grieve with the families and loved ones of those lost in this accident. This tragic event is a reminder to all Canadians of the tremendous work that the women and men of the Canadian Armed Forces do on international operations, as well at home here in Canada. Their response exemplifies their commitment to service. And as you know, across Canada, governments of all levels are working to slow and stop the spread of COVID-19, and while at the same time protecting our most vulnerable populations. Nowhere is this more evident than in our long-term care facilities. These places are home to thousands of our parents, our grandparents, and our loved ones. They gave so much of themselves to ensure that we have a better life. And now it's our turn to make sure that we take care of them. That is exactly what we are doing in our whole-of-government approach in our fight against COVID-19. Our frontline healthcare providers have been working tirelessly through this crisis, and the women and men of the Canadian Armed Forces have joined them, working beside them to keep our seniors safe. Over the past weeks, both Ontario and Quebec requested the assistance of the Canadian Armed Forces in their provinces' long-term care facilities. Canadian Armed Forces reconnaissance teams moved quickly into Quebec and Ontario to assess specific needs to support planning for deployment of personnel to support in these long-term care facilities. And in Quebec, we have already been supporting 13 long-term care facilities. And as of today, the Canadian Armed Forces will have over 1,020 personnel committed to the support of 20 long-term care facilities, with over 670 medical and support personnel will be contributing inside the facilities, while nearly 350 members are providing essential day-to-day support, such as delivering personal protective equipment and other needed supplies, maintaining a liaison with the province, as well as planning to refine operations to better support the patients of those long-term care facilities. And as we speak, we are working to deploy additional teams, bringing the Canadian Armed Forces support to a total of 25 of Quebec's long-term care facilities in the Montreal area by mid-May. In the following week, when deployment is complete, we expect to have over 1,350 members dedicated in helping our loved ones in long-term care facilities, and we continue to work with Quebec to support them in their need. Meanwhile, in Ontario, there are approximately 265 women and men in uniform who are actively providing support to 5 long-term care facilities. We are working day and night in long-term care facilities in Pickering, Scarborough, Etobicoke, North York, and Brampton. Though this is not a typical Canadian Armed Forces operation, the Canadian Armed Forces can adapt to any situation, and they do it well. And I can assure you that our people have been properly trained and are equipped and are up to this task. Members have received instructions in how to integrate with health services staffs. They have been trained on the use of medical-grade personal protective equipment, and they have also received a long-term care facility orientation facilitated by the provinces. We know many Canadians are worried about their loved ones in these facilities. They're concerned for their health and the added stress of the isolation that our parents and grandparents are experiencing. It is why when Canadian Armed Forces have been called on to serve, they are there in their time of need. And they will do whatever they can to help healthcare providers in these long-term care facilities maintain the health and well-being of vulnerable Canadians. While some of our members are deployed to long-term care facilities in Quebec and Ontario, many Canadian Armed Forces members are responding to various requests for assistance across the country. And I continue to work with Minister Miller and Minister Vandel to support their efforts to help our northern Indigenous and remote communities across Canada. In northern and eastern Quebec, there are approximately 200 Canadian Rangers supporting 26 different communities, helping local health authorities limit the spread of COVID-19. They are educating people about physical distancing, supporting the work of healthcare personnel, and assisting with the delivery of community-owned supplies. And in Saskatchewan, Canadian Rangers are providing critical support to communities of Walston Lake, Île-à-la-Crosse, and Fond du Lac. We have also Canadian Armed Forces members in Ontario assisting Public Health Ontario with contact tracing. They have already contacted hundreds of Canadians to help monitor and slow the spread of COVID-19 in our communities. And just last week, when Minister Anand informed me that there was a shortage of swabs in Nunavut, we worked cooperatively together to get this critical material up north. The Canadian Armed Forces members are helping the Public Health Agency of Canada manage PPE in warehouses across the entire country. And behind the scenes, civilian and other defense team members are helping out in a number of ways to ensure that these deployments are possible. They are working alongside a number of federal departments, for example, to fund research and innovative solutions to COVID-19 challenges. And our defense scientists and researchers are also working hard to apply their expertise to develop solutions. In addition to COVID-19 efforts, Operation Laser, defense team members stand ready at all times to support Canadians in the face of any domestic emergency. As our personnel in uniform continue to deploy into various communities to protect the health and safety of Canadians everywhere, and their health remains our #1 priority. And since the beginning of this operation, we have released clear guidance on how Canadian Armed Forces members can remain healthy and adjusted to operations to protect our personnel and provided them with the necessary PPE. Throughout this pandemic, our focus will remain on keeping the forces healthy so that they can be ready to help Canadians when called upon. And we continue to work with public safety and our provincial and territorial partners to monitor the flood and forest fires risk across the country. And the women and men of the Canadian Armed Forces stand ready to help if it is requested. The women and men of the Canadian Armed Forces and the whole civilian defense team will always be there to help Canadians. We have done so from the beginning of this pandemic, and we will continue to do so. Thank you very much.
Merci beaucoup, Harj.
Thank you very much, Harj. Good morning. Before beginning, I would like to extend my most sincere condolences to the family and loved ones of the Captain Ian Brandon McDonald, Abigail Colbro, as well, Captain Kevin Hagen, Captain Maxime Miron-Morin from the first-class vessel Michael Pike, and Chief Corporal Matthew Cousins. We paid tribute to them yesterday at CFB Trenton. Their loss is a tragedy for us all. We continue our efforts to repatriate and find the helicopter that crashed. An investigation team of 7 people went to Italy to find out what exactly happened during the accident. There is investigators, a medical advisor, an engineering advisor as well, and also a representative of the manufacturer of the original equipment. The data and voice recorders have been repatriated and are now in Canada. The content will be examined by a research council. We are working to recover the rest of the fuselage as well. And there are separate military investigations underway to determine the cause of the accident and to provide administrative support to family members. This is a specific professional investigation, a number of them, and they will help find the answers that families needs. We will be providing support to families during this difficult time. Our thoughts are with them. Quebecers are worried about their parents and grandparents and what's happening in our long-term care facilities. There are no words to describe the situation. And I think of my own parents and how I would feel if they were making the headlines in such a difficult way. Our parents have taken care of us. They took care of us when we were little, and it is now our turn to take care of them. It's our turn to do it, and it's the least we can do. They need our help. As of today, there are over 1,020 members of the Canadian Armed Forces who have been deployed to help our seniors in 20 different facilities in Quebec, in the Greater Montreal region. And we've also announced that there will be military personnel deployed in 5 other long-term care facilities. By next week, over 1,350 members of the Armed Forces will be there to help seniors in 25 long-term care homes. We are not going to let you down. The province of Quebec asked for more personnel to be deployed to 5 new centers that have been, or long-term care homes that are considered critical in the Montreal region. And as you know, members of the armed forces are professional. They adapt quickly. They are not used to this kind of deployment, but they learnt quickly. They did it willingly. They are happy to provide their services in this way. And I can say that their help and their support is extremely appreciated on the ground. They are well equipped. They are well trained in the use of personal protective equipment, and also in the way that care should be provided. They are ready. They are doing everything that they can to help our parents and our grandparents, and they are treating our seniors with all of the respect and dignity that they deserve. In the northeast of Quebec, there are about 200 Canadian Rangers who have been deployed to help 26 communities. They are giving a hand to the local health authorities, to officials to stop the spread of COVID-19. They are raising the awareness of people about the need for physical distancing. They're helping healthcare workers on the front line. They are facilitating the delivery of supplies as well. They are visiting people in the communities just to make sure that they're doing okay. They're cutting firewood, they're delivering it, they're helping seniors, they're delivering groceries and medication as well. They are doing all of the things that we need them to do, and we thank them for that. The members of the armed forces are also helping the Canadian Public Health Agency to transport equipment and supplies throughout the country, and there is the civilian part of the defense team that is also helping to facilitate all of these deployments. So this is a great deal of work that's going on behind the scenes that we do not see, but that is just as important. Our scientists and researchers in the defense team have been working closely to develop innovative solutions for the fight against COVID-19. I would like to sincerely thank our armed forces for their effective action. They are of our seniors, and we have to make sure that they stay healthy. So we have clear directives, and we have PPE there to support the Canadian Armed Forces members' health, because they have to be ready to respond at any time. So we continue to work with the provinces and territories to also be ready to figure out where the armed forces may need to be deployed to face risks such as floods and wildfires. The armed forces are there. They're standing ready to respond, and we will not let them down. Thank you. Let's start on the phone for questions.
Please press star 1 if you have a question. Appuyez sur étoile 1 pour poser une question. Notre première question est de Marie Vastel, du Devoir. À vous la parole, please go ahead.
For you, I guess a two-part question. I'd like to know, you've said before, the government has said before, that the members of CAF had to follow some training before they could be sent to long-term care homes. So I'd like to know how long that training takes, and I'd like to know if the CAF are, I guess, training in anticipation that more of them could be called upon to go help in Ontario, Quebec, or elsewhere. We know that the situation is not necessarily under control in Ontario and Quebec yet, so are you preemptively training more people so they can get deployed quickly if there is a new ask?
Thank you for the question. Making sure that our members have the appropriate training is about making sure that we're providing the appropriate support for our seniors who are in these long-term care facilities, to making sure that they get the respect and dignity they so deserve. So yes, there is training that is required by the provinces. It goes over a number of days, but it also goes through the medical protective equipment that they need to be trained on. Plus, it also allows them to figure out what the exact needs are in the long-term care facility, so that we can actually provide the necessary support. And when in terms of our capacity to provide that level of support, as you know, we have a limited number of Canadian Armed Forces medical personnel across the country. Our medical system that we have is designed to support Canadian Armed Forces members. But in this time of crisis, what we have done is try to bring all our medical personnel, go down to a bare bone support for our Canadian Armed Forces members, so that we can train them with the other support members and provide a complete package for that level of training. So, given I know there's a much greater need, but what this is an example of is how the Canadian Armed Forces can provide that necessary support temporarily, while allowing the provinces to build up that pool of well-trained people and being able to support them in the long-term care facilities in the long term.
Okay, so as a follow-up, you said the training is a number of days. Can you be more specific? Is it 3, 14, 21, 35? And you didn't quite answer my question on whether you're training more people preemptively in anticipation that more people might be asked to go and help in those long-term care homes. So are you training more people already just in case?
So the training itself takes a number of days, approximately 5, but it's going to be different based on where they're going. And in terms of being preemptive, we are actually bringing free Canadian Armed Forces medical personnel into this fight. So it's not that we're trying to look at, we only have a certain capacity inside the Canadian Armed Forces of medical personnel. And to do this well, we need to make sure that the right people are there, so that the people who are not medically trained can actually do this with the right training and the right supervision. So that's very important here. We are pulling in all our medical personnel into this fight, and we are doing as quickly as possible, give the appropriate training, and get them into the long-term care facility. As soon as they're trained, we're sending them out just as our reconnaissance teams get that information. And that's one thing I want to be able to assure Canadians, that we are all in and going as quickly as possible in support of this endeavor.
Thank you.
Thank you. Notre prochaine question est de Lina Dib de la presse canadienne. À vous la parole. Please go ahead.
Oui, merci.
Question. Yes, Mr. Rodriguez, the question is for you. So I was wondering, are you counting the 125 people who were deployed at the very beginning before the request that came in? Are you counting that in the 1,020? And on March 30th, when your colleague Mr. Sajan said, and also the Chief of Defense Staff said that there were 24,000 members of the armed forces that were ready to be deployed quickly. That was about a month and 10 days ago, give or take a week. So I wonder, can you explain why it took so long to deploy 1,020 military personnel? Answer. Well, it happened pretty quickly. It's progressive. But if you look back, there was a first request on April 15th. If I'm not mistaken, it was a specific request to obtain medically trained military personnel. So it was pretty specific as a request. And then 6 days later, there were 125 of them deployed to our long-term care facilities right away, in less than a week. And then there was another request on April 2nd. And then 9 days later, the armed forces were present in more long-term care facilities. And then there was another request in early May for another 5 long-term care facilities. And so this was happening progressively. So we deploy as quickly as possible, given the requests that come in. And as the minister said, this takes training on what to do and how to operate the equipment and that kind of thing. There's a reconnaissance phase at first, but if you look at everything, you'll see very quickly the armed forces will be present in 25 long-term care homes with approximately 1,035 members of the Canadian Armed Forces in attendance. Question. I understand, but between the request for 1,000 on April 2nd and today, more than a month has gone by. So what happened to the 24,000 members of the Canadian Armed Forces who were ready to deploy quickly, who had been isolated to make sure that they didn't have COVID-19? And so if it takes 5 days to train them, as your colleague just said, why did it take 5 weeks? Answer. So we operate based on requests. And the first request was very specific. There was a request for people who were medically trained, doctors, nurses, people who have that kind of training. And we were able to provide 125 at that time. Then when the request broadened and that famous figure of 1,000 that you're talking about came out, then we moved quickly, and then we had to do some reconnaissance. We can't just go to a long-term care facility and just like that overnight. It has to happen with the partnership of the provinces and for the people who actually work there. So it happened gradually. And we've come to the point now where next week there will be 1,035 members of the Canadian Armed Forces in 25 long-term care facilities in Quebec, and they are very happy to be there and to make their contribution.
I want to add to this is when we talk about the 24,000, the Canadian Armed Forces members that are ready, it's important to note that these members here, we're talking about our Air Force, our Navy, and our Army personnel. In response to, we have to look at the entire country and support. So the plan that we put into place is making sure that we're able to respond to various emergencies across the country and anticipate everything from forest fires, floods. I'm still very concerned about the northern communities. Those are those things that are extremely important. So the 24,000 force that we have is a package for us to be able to respond. In terms of the support for the long-term care facilities, it's extremely important to note, for us to do this, it requires our medical personnel as well. So we have taken all our medical personnel, brought them to Quebec to be able to make those specialized teams, give them the appropriate training, and move as quickly as possible. One thing I can assure you, and something I'm extremely proud of, our Canadian Armed Forces members have moved very quickly, figured out the training, done something that they have never done before, because that's exactly what was needed for our elderly. And I'm very proud of that work. And of course, all of us would like to have moved faster on this. But one thing I can assure you, our Canadian Armed Forces personnel are moving as quickly as possible to provide the adequate support.
Thank you. Notre prochaine question est de Raymond Filion de TVA. À vous la parole. Please go ahead.
Oui, bonjour.
Question. Mr. Rodriguez, I'd like to come back to that question. When Premier Legault says, like yesterday, when the military deployment in long-term care homes should have happened more quickly, what do you answer to that? Answer, I would say that we did what we had to do in the way that we had to do it. We did reconnaissance. We cooperated with the province of Quebec and the people in the long-term care facilities concerned. And this happened over a period of about a month. And now we are deploying 1,035 members of the Canadian Armed Forces in 25 long-term care facilities. And they will all have been trained about exactly what they have to do there, how to use the equipment as well. So this is a deployment that happened gradually based on requests, but it's happening quickly. Question. Do you have more military personnel that can be deployed if there's more demand from Quebec?
The long-term care facilities or other support. It all depends on what the tasking, the request would be. We are, in terms of the work that we can do in the long-term care facilities, is dependent on the number of military medical personnel that we have, including our doctors, our nurses, and our the numbers that we have inside the Canadian Armed Forces. This system is designed, a medical system is designed to look after Canadian Armed Forces personnel. So normally it's not designed for help for providing support, because that's what the provinces do. But nonetheless, because there was a need, what we have done now is taken all our medical personnel across the country, brought them to into Quebec and Saint John to do the appropriate training, and only leaving the absolute minimum on bases and our ability to support certain northern communities, because we need to be ready for there as well, to basically maximize our capacity to provide the support. And that's exactly what we're doing. We are literally going full out in our capability to do this. Yes, we have obviously a lot more members, but for us to do this, and more importantly, to us to do this well for our seniors, you have to have the right people. That's why not only the training is done, but also based on the provincial guidelines, you need the appropriate training. I was told it takes close to 700 hours to train somebody in a long-term care facility. And what we're doing is doing this training very quickly. But one thing I can assure you, we're moving as quickly as possible and to as many facilities as possible so that we can provide the support that Quebec needs.
On va aller maintenant dans la salle. Julie?
Julie Van Dusen, CBC. So for Minister Sajjan or for General Vance, I see him here as well. I'd like to know exactly what they're doing in the homes. There's a lot of things to do in a long-term care home, right? There's cleaning, there's changing diapers, there's feeding people, there's helping with activities. Mr. Rodriguez, you said ils sont heureux to be there. They're happy to be there. I'd like to know more about that. I mean, do they have a choice, or did some people quit and say, I didn't sign up for this? So I want to know what they're doing and just generally how it works.
Chief, if you want to just get ready for the question. What I'll tell you is that when it comes to forces members wanting to, who are serving when Canadians need their service, they step up. Yes, this is something that they're not trained to do, but Canadians needed their service, and they have stepped up. And there is a list of various tasks that they are doing. Some of them, actually most of them, have to be done in the supervision of somebody who's medically trained. Hence the reason why we have taken our medical personnel across the country, brought them in, making sure that they have the right supervision. They're going through the necessities of life are provided as well. And from all accounts, from what I've seen, is the Canadian Armed Forces have been very proud to do this work, because when they put the uniform on, they're there to serve Canadians, and I'm very proud of their efforts.
Could you expand that? This is still part of my first question. So are they reading to people, changing diapers, or are they just, I don't mean just, but are they helping? Be more specific if you could.
Chief, you want to get into the details of it?
The teams are comprised of 24/7 capacity, so 2 senior medical personnel, think registered nurses, medical technicians. They can work shifts, about 6 or 7 medical technicians per shift. Think paramedics. Remember, we're trained mostly for trauma type work in the military medical system. And then attached to that 24/7 team is a platoon of support troops. And those support troops principally work inside, and you should think in terms of orderly type functions. Moving equipment, helping with logistics on the inside, cleaning, and food service. Duties not associated with the intimate medical care of an individual. The intimate personal support care that you would expect someone to do, you mentioned some of those functions are being done either by our medical people or by our medical people with some help from the orderlies, the support troops, for being able to move someone, get them out of bed and so on. We are very conscious of the fact that there is something about the medical training that makes someone far more suited to the intimate, not only medical care, but that intimate support care that you would expect to be offered to people in long-term care facilities. But the orderlies are there to support them. There are no tasks, so to stand on this, Julie, there are no tasks by non-medical people that should have a medical person do them.
Okay, great. I have a chopper question. Would that be for you or for the minister? For you? Okay, thanks, sir. So maybe you could just tell us how the salvage and recovery operation is going to proceed. It takes so long to call it a recovery operation, especially when it was evident the helicopter went down in front of witnesses and had been lost entirely.
One thing is the commanders on the ground. It's a very extremely fluid and a sad situation. We need to make sure that the people on the ground are able to conduct their work, and the decisions are based on what they see. In terms of the next steps, we're currently actively planning those next steps, and as I stated in my statement, we will continue to work to find the remains of the 5 fallen heroes, and also we are in planning on the next steps of recovery of the fuselage. But one thing I can assure you is when this tragic incident took place, all steps were taken of making sure that we informed the families and looked after them, protecting the integrity of the investigation. And throughout this horrible ordeal, we will make sure that the families are informed, and will inform Canadians on this, because they deserve to have answers.
On va y aller avec une autre question dans la salle.
Hi, Rachel Haynes from CTV National News. My first question would be for Minister Sajjan or General Vance, also about the chopper that went down. You said that the flight recorder is back in Canada. How long will it take to get the results back, or any of the information from that recorder? And also for the eyewitnesses that saw the plane go down, the chopper go down, what kind of information have they given as well?
Chief, you want to get ready for getting the details of it? But when it comes to this investigation, one thing I can assure you, it'll be extremely thorough investigation. The team that we have, they've done this work before, and they will get to the bottom of this. But it does take time. Just like any other thorough investigation, the witnesses will be obviously questioned. The voice and data recorders will be looked at, but it does take time to making sure that all the information needs to be collected, and a thorough report will be done. This could take anywhere between over a year, but as we get certain information and when it's appropriate to do so, we'll be able to keep the families and Canadians informed. Chief?
Thanks, Minister. Rachel. The flight safety team is like the Transportation Safety Board. We've got to give them all the room and authority to proceed at the pace that they can. This is a sophisticated team with sophisticated capability, and all of the data and deductions from that data will be done obviously as quickly as possible, and communicate to the public when it's appropriate to do so based on the judgment of that team. What you will know, what you must know, is that when that investigation is done or when appropriate, based on the judgment of that team, the families will be told first, unadulterated, told exactly what they've got. And then the public will be told. And so I know there's great interest in speed here. We're more interested in accuracy. There's nothing self-evident about a crash. Nothing. And a recovery operation at that moment is not about the helicopter. It's about the people that may have been on it or in the water. And that's why I think as we use terms like search and rescue and recovery, what that crew was focused on at that time was to get to that crash site and determine survivors or no, and if there were, where are they, where might they be, and where are remains in the water if there are no survivors. That's what went on. And sometimes there's a distinction without a difference between a search and rescue and a recovery. And eyewitnesses or no, the fact is that flares were seen and they knew a helicopter was down and they needed to get to it. And the reporting was done as best as we could, given the frantic, professional, intense work being done by that crew to try and do what they needed to do. And at the same time, report up. So I'm very proud of what the captain and crew of that ship did in the immediate aftermath. And all witnesses, anybody that has anything relevant to say or offer in this investigation, from data to the crew to the maintainers to the equipment manufacturer, all the rest of it, will all be included in a very, very professional investigation. And that investigation will get done. The families will be briefed on it, as will you. Thank you.
And still just a part of that question, what so far have the witnesses told you about what happened?
The witnesses are not going to tell me anything. They're going to talk to a flight safety team, and that's going to be done with privilege as they go through this investigation, and not released to the public in dribs and drabs as they go through this. The flight safety team has to get a whole picture. So we're not planning on proactively releasing what witnesses, if there were. I mean, by the sounds of it, there may have been, but we're not going to be releasing that. Okay, it'll all come out together as a proper flight safety investigation.
And for my second question, this one has to do more with the long-term care homes like we've been talking about. Have any Canadian Forces members who have been deployed to any of these long-term care homes shown any symptoms of COVID-19 or have tested positive for COVID-19?
Well, we are not sharing our numbers in the Canadian Armed Forces, obviously for security reasons, but one thing I can tell you across the board, really good measures by the military that were taken early on to protect the force have worked. But nonetheless, our members are going into a high COVID-19 environment. We will take all necessary steps to making sure that we keep them safe. And if there is any symptoms, our people will be looked after in a very professional manner.
We'll go back to the phone, so moderator.
Thank you. Notre prochaine question est de Louis-Samuel Perron de la Presse. À vous la parole. Please go ahead.
Oui, bonjour.
Question. Yes, good morning. Among the members of the Canadian Armed Forces deployed in Quebec since the beginning of the crisis, how many of those have tested positive for COVID-19?
As I stated, we are not, for operational security reasons, not giving our numbers. But one thing I can assure you, as I stated earlier, because we took measures early on and to protect the health and safety of our people so that they can respond, that we have done, the Canadian Armed Forces done extremely well. And we will continue to do so. Any task that we ask our Canadian Armed Forces personnel to do, whether it's in long-term care facilities, fighting forest fires, or any other task that might come up or request, we will make sure that they have the appropriate training and the appropriate equipment to do so. And as I stated, they are going into a high COVID-19 environment in the long-term care facilities. If there are anybody with symptoms, that they will be looked after in a well-professional manner.
Poursuivi.
Oui, parmi
Yes, question. Among the members of the military personnel deployed, how many are reservists?
I don't have the exact numbers of who are reservists. What our Canadian Armed Forces members, personnel, we're bringing in as many as possible with the right training. We have, as I stated much earlier, that allowed any reservists who wanted to be on a full-time contract to be on a contract. That has allowed many people to have stepped up and given us a lot of flexibility. But when it comes to the management of within the Chief of Defense Staff has Canadian Armed Forces personnel, both reservists and regular force, ready in a very professional way. But the way we had to do the support for the long-term care facilities, we had to look at all our medical support from regular and reserve. So we don't have the exact numbers, but one thing I can assure you is that the reservists are actively supporting in Quebec.
Prochaine question.
Our next question is from Bruce Campion-Smith from the Toronto Star. Please go ahead.
Hi, good afternoon. Thanks for this. Just a quick question on the state of the medical personnel in the military. You've said that 350 have been deployed on this operation, and you say that that's kind of taken the personnel across the forces down to a bare bones. I'm wondering, coming out of this, does the medical capacity of the forces need to be reassessed and perhaps bolstered?
No, it's a very good question. It's something that we will be looking at all the various lessons. I think no one in Canada or even the world, would think that we would be in an environment like this, and we will do our necessary lessons learned on this pandemic, just like our entire government will be, to making sure that we have the right support for Canadians. And this is but this right now, our main focus is making sure that we support Canadians at their time of need, and we are moving as quickly as possible to do so. And these discussions we will have at the appropriate time.
And just to follow up, switching to the recovery of some of the wreckage of the cyclone, has the fuselage been located, and it's just a matter of logistics of retrieving it, or is a search underway, to find it? And I'm just wondering if you can kind of speak to the logistics of that search, given the depths of the water down there.
No, this is going to be a very complex operation, given the depth of that water, the sophistication that's going to be needed for the location and the recovery. I know that many of our allies has stepped up and offers support, but we're not at a time to give further information yet. But one thing I can assure you, we are actively looking at many options for the location and the recovery efforts, and we will leave no stone unturned to making sure that we bring closure for the families.
We'll take your last question on the phone, please.
Our last question is from Émilie Bergeron de l'agence QMI. À vous la parole.
Hi, my question is for Minister Sajjan. I would like to know if members from the Canadian Armed Forces that are deployed in long-term care facilities, do they change from a place to another during the mission, or are they just affected to one place?
From what my briefings that I received, and Chief, you want to elaborate on that if you feel necessary, but no, the work, how we've been doing this is one of the reasons why when we look at going in, it's about making sure that we provide the right support. I mean, it is heart-wrenching to see the conditions what our elderly have been. And we want to, so when we want to go in with the compassion, the right training, and give them that dignity and the proper support. So the reconnaissance that we're doing, we're actually visiting those, our members are visiting the facilities, finding out what the exact needs are, what the size are, because as you know, the long-term care facilities, some are small, some are much larger, some have certain type of staff, and that allows us to bring in the right support. And so when the teams go in, as General Vance stated, we come in with a 24/7 support for that long-term care facility. And this allows our people to be able to rotate it and at the same time get that hands-on experience from that facility. So from what I understand, that they're not will not be rotating, but we're also looking at those additional facilities. And as I stated, by May 11th, we'll actually have our numbers up even higher. But this all depends on each facility. So we're actually, I know there's a lot of discussion about the numbers. What we're focused on with our max capacity is how much support can we provide, because one care facility is different from another. And what we want to do is when we go into a care facilities, that we're providing the appropriate support for the elderly that they so deserve.
Question suivie?
Yeah. Okay. So thanks for that. I'd like to know how often are members tested for COVID-19, and also, do you have in mind how long could last this mission? Do you have a final date, or it's going to be as long as Quebec needs it?
First of all, when it comes to the health and safety of our people in the COVID-19 environment, we are taking all measures, whether it's, especially when it comes to the protection and prevention of our of getting the COVID-19 for our people. That's the number one priority, and we will take all necessary steps as required based on any individual situation that might pop up. And what was your second portion of the question?
How long could last the mission in the long-term care facility?
No, thank you. And what we're focused on right now is moving as quickly as possible to those long-term care facilities. But we, obviously, when the military goes in, we're able to provide the provinces the time to be able to bring in and look at providing the right support. And I know that the many departments of public safety, ourselves, and are working with the province on how they can bring in the appropriate support, just as what we're doing in Ontario as well. And that's very important, because ultimately our elderly deserve to have the right type of people who are appropriately trained to do so. And so the Canadian Armed Forces going in, as much as I'm extremely proud of the work that they do, this is not something that they're appropriately trained on. But it does buy the province enough time to be able to bring in the right support. And we will be working on the appropriate timeline as necessary. But we're right now focused on making sure that we provide the right support for the elderly.
C'est ce qui conclut notre point de presse. That concludes. Thank you. Merci.